Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board-certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun.
Hey guys, do I have the episode for you today? If you've been on Instagram or TikTok or even on the internet, you have heard about buccal fat removal in the last few weeks. Everybody's talking about it. Everybody's either for it or against it. And you guys know I always try to bring you the best information, the most accurate medical, let's look at this differently than just people on Instagram saying it's a good idea or not a good idea. I always bring you guys everything that I know. And I know that there is a right way of doing it and there's a wrong way of doing it. And today I'm super excited to have a doctor at Chicago on with me today, because who else to talk about this than the man himself?
There we go. Also drbuccalfat.com. So I think this is a poignant time for me to be, out there.
Dr. Buccal Fat. So I'm going to let you take the lead on this. My girls love to hear from the surgeons and they love to hear, what they should be looking out for in their own journey when they're looking at these procedures. What should they be aware of?
Okay, great. So listen, I could talk about buccal fat for 24 hours straight. There's a couple key points. And we're doing, there was this YouTuber, Stephanie Lange, and she put a big thing out there, how people who get buccal fat look disgusting, all this stuff. So first thing you got to do when you're talking about buccal fat or any aesthetic, this goes from butts to breasts to face to men with pec implants or calf implants, is first define what you feel is attractive. So that lower third contour is the classic kind of fish face. When you kind of suck your cheeks softly, if you like that contour, then buccal fat could possibly be something for you. If you do not like that contour, if you want the more full round face, then it's not the right thing for you. So that's number one. Define what you think is hot. Then we can talk about whether or not buccal fat's the right thing for you. Another thing, because one of the biggest arguments about buccal fat is people think it's going to age them, make them look old. So let's define what looks old. A contoured lower third, in my mind, Angelina Jolie, Ariana Grande, Kerry Washington, these people don't look old. They just look contoured. But there are people out there thinking that that's an old look. So those are really the pivotal points when you're talking about buccal fat. The technique and how we do it, how much we take. We can talk about that. But really, first, you got to define what buccal fat can do and what is your aesthetic.
Let me tell you, when I was going to have my body surgery, I thought about getting my buccal fat removed. And my surgeon at the time, he told me, I want you to go home and look at your grandma and look at your mom and see how their faces have aged. And if they look like they still need their buccal fat, or do they look like, those little kind of, you know what I'm talking about?
Cachetes.
Or
it kind of leads to almost a bulldog look.
Yeah.
In the older population.
Yeah. So my mom and grandma didn't. They do still have very round faces. Mm-hmm. So I was like, you know what? I might leave it in. I might need it later because it keeps my mom's face looking youthful because we have round faces, for me.
Yeah. So that's the key. It's and you really got to define, if you like that more round look or you think that's what you're after, definitely don't do it. There's a lot of other ways to sculpt a face. So I think that's a great advice. I always say, is your mother around? Is your grandma around? So people got to know what they like. That's really the number one.
But something that I really love about your approach is that you don't just talk about buccal fat. So you look at the whole jawline. And I love how you put it into words, how it's all of it goes together, and you do it could be multiple procedures to give you that look that you're looking for.
Of course, the face is a three-dimensional, dynamic, very mobile aesthetic, portion of the body. So 100%, that's important. My focus is really the jawline, buccal fat is just one of those things we can use to sharpen a jawline. So I talk about it like what people seem to like is a nice peak there, a little bit of a valley here, a straight peak along the jawline, and then a valley under there. So you can make the peaks more peaked. You can make the valleys more deep. I mean, these are ways to kind of create these shadows and curves. It's very much like when somebody's doing a BBL or augmenting a butt or a breast. It's the curves, the peaks, the valleys, the shadows. That's what everybody's after. So I just do it for the face and the jawline.
And you do such a good job. I really love your before and after pictures. I can tell that your patients choose you because they love you. They love the vibe.
Listen, I like what I do. Another phrase I say is like, when you love what you do and you're good at what you love, that's the key, because then you're doing what you love and you're good at, it's a snowball, right? So I do more and more and more. I mean, the jawline, I'm at like 99% jawline now. A good looking jawline is everybody likes it. Old people, young people, gay people, straight people, trans, man, woman. I mean, everybody wants a good jawline. Now, we can make it a little more masculine, a little more feminine. There's different approaches to it. I got some guys that want the Jay Leno. I have some women that want a really pointy, jawline. So yeah, it's a fun part of the body to kind of change aesthetically.
You do a really good job at it. So for somebody who's looking for a buccal fat removal, what do you have a specific age range that you're like, if you're thinking about it, don't do it too early or don't do it too late? What do you have a age range?
Listen, I've removed buccal fat in 20-year-olds. 6 months ago, I took it out in a 75-year-old woman. So for sure, any cosmetic surgery, I mean, even lip filler, the 20-year-olds, I really caution them, about it. And you just make sure they're approaching it properly. Probably the average age of my patients is like 38, give or take. So, that's like, because if you still have nice round cheeks by the time you're 38, they're probably not going to, they're where they're going to be. So the two most common reasons I do it, people say, I feel like I look way too young. My face is round. My face makes me look heavier than I am. And I have a group of people that says, I can't get the look I want unless I'm like 2% body fat. So, and they say that's not a realistic place to live for me. So, or anybody who's not a professional athlete, So you definitely, any procedure at the age of 20, you got to be a little careful with. At the same point, we do rhinoplasties in 16-year-olds. So if you're going about it, if it really bothers you and you want to change it and you're thinking about it properly, it's not off the table. You just want to be careful.
Just want to make sure that you're doing your research. So what is something that for our listeners who might be looking for this procedure, wherever they are in the world, what is something that you would caution them? Like, make sure that if you're going to have this procedure done, you look for these things in your provider and in your surgery.
Well, I would tell them to fly to Chicago. We have plenty of people doing that. So, but when we do, at this point, most of my patients are flying in actually. But, the buccal space is a very important anatomical area with some really powerful aesthetic implications. So you got to be careful. There's the facial artery, the facial nerve, the parotid duct, the parotid gland, the superficial layers, the muscles, the orbicularis, zygomaticus, levator, depressor, all within egg space, egg volume space. So in medicine, how you make outcomes good is repetition. So, for instance, the body guys, the guys who are doing all the butt and BBL, sometimes patients will be like, oh, he did my little lipo in my neck and my buccal. I just don't like it though. But maybe he does 8 a year. Like, that's different. I did 500 last year. Now, you don't want me doing your butt lift or your breast implant, but, so super subspecialization, I'm a real proponent of that because that's how you maximize outcomes and that's how you maximize safety. So, and obviously with these aesthetic procedures, there's a lot of pressure. We're taking beautiful people who have nothing wrong with them. They're perfectly healthy and we're cutting them open and suturing them back together. I mean, that's a lot of stress, So you want to go to somebody who's confident and kind of knows what they're doing.
You know what? I really
well-trained, obviously.
Obviously. I love that you touched on this because I get asked this a lot about, like, I'm looking for this specific procedure, but this surgeon that I like, he doesn't do that many of them, or I don't see that many of them on his page for reviewing of before and afters. Yeah. And you touched on how, like, you start to specialize, like kind of niche down into
100%.
even in what you're doing, plastic surgery, you still niche down to a specific procedure.
Yeah, I mean, I was face. Now I'm like only part of the face, even. You know what I mean? I mean, I still do blafts and I'll do otoplasty. I do a lot of things around the face, but like for lower eyelids. Now I send them to my partner or my buddy he's an oculoplastics. It's like he only does eyes. He's given better care than me. So I'm willing to admit that. And I send them to people, I send them my patients that have that issue. And like my body work, I send to Autoplastic or, you know what? Brian Rosette, I saw. Yeah, I love him. He's great.
I love Dr. Rosette.
He's a stud. So I send him a lot of my patients, who do the body work. It's just the reality. So
I love to hear that.
Yeah, it's the reality of people who are busy. When plastic surgeons get in trouble, it's when they're trying to do things that for the wrong reasons. I mean, I'm not out there to diss anybody, but that's when, things happen bad for patients.
Yeah. I caution my girls a lot on the show because as you and I know, there's a lot of people who shouldn't be flinging around a cannula.
Right yeah.
And so I always like to caution my girls whenever they are looking. There you go.
Yeah, just in case.
Whenever they're looking for these types of procedures, to make sure that they're going to somebody who, specializes in this procedure, because then they're going to do it well. They're doing a lot of it. They get a lot of experience. They get to see a lot of different people, a lot of different bodies, a lot of different faces. And that's how you get to a really great result.
Yeah, it goes with anything. I mean, look, like as you do more and more podcasts, you're going to get better. You, Mavi, as a podcaster, not that there's room for improvement, but the more of anything we do, that's just how you get better. It's like the rule of 10,000 when people say it takes 10,000 hours of doing something to become an expert, I mean, with surgery, it's exactly the same. I mean, I'm still learning and I have thousands under my belt. I mean, it's just the reality, and there's people who have done 5 buccal fats and you're going to be their 6th, I mean, somebody was my 6th, it's the reality. So it's just how the world works.
It's just how it goes.
It's how it's how humans, our brain, our function, our physiology is how we learn and get better.
I really love how on your Instagram, you really take on your trolls. I love that. I love that.
And you know what? We definitely have fun with it. And there's a lot of haters out there. And it's the curtain of the social media brings them out even more. So I think, like you said in the beginning, you got to fight trolls or false information with just more information. That's the answer. I mean, you don't need to silence anybody. You need to say, hey, you're going to say that, plastic surgeons are worthless, but look, we're doing a lot of good stuff in the world.
We're changing lives.
Yeah, exactly. Like we're changing lives there. And then what about the people who get run over by a car? Like it's nice to have somebody who knows the facial aesthetics at that moment, isn't it?
Exactly.
So it's a little bit like that. Yeah.
So I know that you also take care of trauma patients for facial surgery. So like jaw. I bet you see a lot of stuff.
Yeah, cancer. And we do a thing with Face to Face and Break the Silence. It's like a domestic violence program where battered women and men who aren't able to afford cosmetics. So then, I mean, I have literally $1 million. There's a great Break the Silence. If you guys want to go to Break the Silence, I think it's .org. You can donate to them. All the money goes towards helping these people, but we do their procedures for free because listen, I have literally $1 million worth of lasers and devices and stuff that we don't have at the county hospital, for instance. So somebody goes there, we put them back together, but we don't have the tools to make them look slick, So they come here and we're able to help them in that way.
That's beautiful. I love that. Because you guys, whenever I was in my career, I have had experience with trauma, but mainly my focus has been in cosmetics. But when I did have trauma patients, especially face, I remember how traumatic these experiences were. So it's so nice to have friendly and great doctors on the other side taking care of those traumatic issues. Okay, so let's talk about the actual buccal fat procedure. So there's a lot of ways of doing this. And if my girls, if you're coaching with me, and you're telling me, oh, I want to add a buccal fat to my surgery. And I always advise against it. I'm like, you guys, you can just do it later in the office under local. Let's focus on everything else that we got going on. So tell us why the difference between having a procedure with local versus in general, kind of the whole rundown of buccal fat removal.
So, okay, buccal fat. Now, a couple things. I've kind of modified the procedure, and we publish this in 2 international journals. So I do it differently than anybody. So I think that's why I'm getting a little better outcomes, and that's why I'm kind of have become popular with this. But as I mentioned earlier, it's just a really important anatomical area with a lot of significant implications. So what I added to it, if you suck in your cheeks and kind of bite on that. If you bite on that meat there, that's the buccinator mucosa and buccinator muscle. So I take a wedge of that out. Interestingly enough, I started that procedure from at the county hospital. I had a woman with a skin cancer on her cheek. We cut the skin cancer out. She had a big scar on her cheek after, but it was cancer. And then I sutured it together. And then she came back. She's like, dude, my jawline on that side looks amazing. She's like, can you do it to the other side? And I'm like, well, you don't want to risk all those nerves, for no reason. So I was like, and I was doing buccal fat at the time the old way. And I said, if we take that mucosa and muscle from the inside of your cheek, it probably will pull it up a little bit. So she's like, let's do it. So I did it and it helped. So now with my buccal fats, I started wedging that to lift up the little pre-jowl and kind of prevent some of that aging and sagging and to give them a little extra lift. But the point being, since I do so many of the buccal fat, I'm able to kind of be creative in that way and modify it and try to maximize the results. As far as the procedure goes, it is under local. Many of my patients are getting chin implants and jawline along with it, which I still do under local. We give you some pills to it's kind of like being stoned or drunk sensation. But yeah, a relatively quick procedure, takes on the order of 30 to 45 minutes. You still look pretty stupid for like 7 days, even though it's relatively simple. You swell up pretty dang good.
You look like a chipmunk. You just swell up. You look like a chipmunk.
Wisdom teeth out kind of thing. Yeah, exactly. So it's hideable. I've definitely had people go to work the next day, but everybody's going to be like, what happened to you? You look weird. So
for our girls who have already had this procedure, like sometimes they'll find us when they're looking for these procedures after they do have it. On the inside, what kind of care is there for after the buccal fat removal?
Again, everybody's a little bit different, the surgeon and how they do this. So their post-op instructions would change. So I definitely follow
your surgeon's instructions always.
Exactly. That's my disclaimer, but my way is the best. So, I have a little protocol. I pack the mouth with the specialized gauze. It has a sterilization on it. I have a pre-mouth rinse. I have people start 5 days prior to the surgery. And then since I'm tightening that mucosa and muscle, the suture's under tension. So my sutures last like almost 2 months, which can be annoying, to be honest. Most doctors use the ones that only last like a week. Mm-hmm. So yeah, everything kind of changes with how you do it. But the way I suture mine, it's called a running locking suture. You can eat or drink whatever you want, like immediately after. It's safe to, it kind of hurts. So it's self-limiting in that way. But the post-op care is pretty easy. You just got to wait for the snatch to come,
You just got to wait for it all to heal.
You got to wait for it to heal.
How do you tell a patient when you don't think plastic surgery is a good option for them?
It's kind of a delicate thing to approach because people are disappointed, if you deny them, they're coming to you because they want something, which is why I went into plastic surgery, because I don't like somebody coming to me and say, hey, I have high blood pressure. And I'm like, okay, well, go get some blood pressure medication. I like to be able to change something myself with my own hands. So if they're not a candidate, you just tell them that either it's not the safe option for them, it could make them look worse, the risks outweigh the benefits. Anything we do, there's always a risk and then there's a benefit, right? So, and it's a teeter-totter. You want to make sure those balance out. And, if I really don't think it's the benefit for them is going to outweigh the risk, I'll tell them that, with me, it's not going to be the right option. And then I always advise them, just be careful because somebody will do this to you. There's a lot of bad doctors out there. So, there's many great, but you just got to be careful,
Yeah, because I tell you guys all the time that whenever you're looking for a procedure, if you're shopping around and 5 of them said no, but one of them said yes, that doesn't mean go with the one that said yes.
Yeah, that's good advice. That's really good advice. You don't want to be one of the outliers.
Yeah, if they're all saying no, one says yes, maybe it's time to put it on the back burner for now and think about it again in a year, revisit it.
Yeah, I agree.
See if you still feel the same. See if you still feel the same way about wanting to have the procedure.
100%.
Safely, always safely.
And number one, my practice is built on like 3 pillars: safety, enjoyment, and results. It is really in those order. You got to do safety first. You want to make sure it's a reasonably nice process to go through because it's elective. And then it's about getting you what you want, so you got to do it in that order. It's the right way to approach it.
So, Dr. Chicago, tell us, why did you become a plastic surgeon? How did that even happen? How did that path happen for you?
It's a hard one to answer. Life kind of it wasn't like I was a young kid and everybody thought I was going to be a doctor. I was kind of a little bit of a troublemaker, if anything. So
I think I can tell.
Surprise, yeah. I wanted to be an architect when I kind of got my head on straight. And then at that time, my mother's a nurse. At that time, the economy was really shitty, and my mom was like, you should consider medicine. And I was like, okay. So I was always good at math and science, luckily. So I started taking like the higher level courses. I was doing well. Then I was like, okay, let's apply to med school, So I got into med school. Then once you decide and you determine you're going to be a doctor, you got to decide, like, am I going to be a heart doctor, a medicine doctor, or a surgeon? So I obviously did a lot of construction when I was growing up for work with my father. So I was like, you know what? I want to work with my hands. I want to change things. I want to build things. So that's how I got into the surgery. And then the plastic surgery just kind of came in with the architecture, and it just kind of slowly evolved. And now I'm here.
That's so cool. I love hearing these stories. Our listeners love hearing it too.
It's not a crazy story. It's just like, I changed a couple times. Life goes on, and now I'm here, and I really do like it. I'd repeat it again if I had the option. So,
yeah, I think plastic surgeons it's so much fun because it's cosmetic. So most of the time, y'all aren't really dealing with anything too disheartening or like heartbreaking procedures and stuff like that. So plastic surgery, you guys, it's always fun. The office is so much fun.
We do have fun with it. There's no doubt about that.
And seeing the patients is so fun. Coming back, seeing them. With your patients that fly in, so are you having them stay for a certain amount of time?
Yeah, we typically, depending on the procedure, anywhere from like 1 to 3 nights, I'm able to do it with my protocol. I see them, and then we do virtual follow-ups. So, mostly I'll do like a 2-week, 3-month, 6-month follow-up plan virtually. And then I give everybody, I operate on my cell phone. So any questions, we text and we just keep in touch that way. My cell phone goes to me and a couple people in the office so that we're always kind of available. A guy I trained with in fellowship taught me that, and it's really saved me and patients a few times from any, messes, because if you can catch things early, it's pretty easy to fix things.
I love that. Let me tell you that I tell my girls that if they give you their cell phone number, they're a keeper. Because after hours, calling the phone number, like for my tummy tuck girls, tummy tuck, calling after hours.
That's a big surgery.
Yeah,
tummy
you can't get a hold of anybody.
Somebody in their surgical history, if they've had a tummy tuck, I'm like, okay, you're good. You're not going to be a complainer. That's a big deal. That's a hard surgery to recover. It's a hard recovery.
It's definitely a tough recovery. So I always tell my girls, like, when they're interviewing their surgeons, like before they even book, I want to know if there's anybody we need to talk to, if you're having a rough night, like if we have a question, who do we get a hold of? How do we get a hold of somebody? And when they get the doctor's cell phone number, most of the time they don't even use it. They barely bother you, but it's peace of mind to know if I need to.
Trust me, it saved me. I don't want bad outcomes like the patient doesn't, It saved me a few early infections. They were able to get me. I could call something. I was in Turks and Caicos, actually. And like this person got me and I was able to call me antibiotics. When they had to call the number and, go through the thing and then call the pharmacy, it's like a mess.
It's such a mess. And it also gives the patient a little bit more anxiety. Like, it's a little bit more of a struggle. So Dr. Chicago, I love that. That's
on point.
On point. So that was mainly the main things I wanted to talk about were the buccal fat removal.
Hold up, Mavi. So how did you get into this? I was like, Brian, wait, is she a surgeon? Wait, remind me.
No, I'm not a surgeon. I was a medical assistant and I went into patient coordinating. So I've been coordinating I've been in the industry for about 14 years from medical assistant. I went all through the office. You can put me anywhere in the office and I can work that.
Yeah, we might have to talk after this,
So during the pandemic, I was going through a divorce and I was like, oh my God, what's happening? And I had to leave my job and I tried something different, insurance. And I was like, oh my God, this is deadly boring. This is not for me.
That's the reason I'm a plastic surgeon, so I don't have to deal with insurance.
Yeah. I'm like, this is so boring. I cannot do this. And, working in the plastic surgery office, I realized that there was a gap between what the office can provide as far as support and what the patients really needed once they left the office, once they're out in the real world. So with the podcast, I mean, I was a coordinator and I was like, I wish I could coordinate for like everybody, like everybody.
That's cool. I like that.
So that's what I did. I was like, let me put it out there. My girls needed information. I have a lot of ideas, and then I have I'm not afraid to shoot my shot. So
there you go. I like it. That's great. Yeah, it's funny because Allie, my coordinator, like has so much knowledge that, I don't want to say it's wasted just here, but you're probably in the same boat.
Yeah. Hey, Allie, you can come on the show. We can pick your brain.
She wants Allie G on the show. Okay, I'll tell her.
Because the coordinators, like the doctors, y'all get to see when the patient's in the room.
To us. They're different to us.
Yeah. Y'all, let me tell you. So you get to see the patient. They're super nice and they're proper. And then you guys leave the room and then it's real talk. Then it's like, oh my God. Okay. So what did you think? And now let's do this. And we get into girl talk and it's my favorite.
Yeah. Okay, good. I'm going to tell Allie. I'll have Brian set you up with her.
Yeah. Because the coordinators are kind of like the conduit between you and your surgeon. They're helping you kind of figure out what it is that you need while at the same time figuring out what the surgeon can do for you, all of it together.
You said, you mentioned that you were an MA also. Like if you go to my Google reviews, Allie is my coordinator and James is like my head MA. Like almost all over the reviews mention those two. I mean, it really is a team effort. Like, and I think it's really important because the patients probably communicate with them more than me, pre and post-op. I mean, I'm there to answer any medical questions, obviously, but most of the
conversation,
are with those guys. Yeah, so
that's what? High five, James and Allie, because that's.
I don't think James will be on here, but Allie will be on.
That is really good because the patients, whenever they start building, I actually teach this. I help spas whenever they're kind of struggling and all of that. I teach them whenever you put your patient at the middle of your triangle, they're the star. Like there's no way you can go wrong. They're happy, you're happy, your surgeon's happy, everybody.
It's all about happy patients. There's no doubt about that.
And the happy patients tell everybody. So before we jumped on the call, I was talking to Brian, and he was talking and he mentioned about how there's two different types of patients in the Midwest. So why don't you tell me about that? The two different types of patients.
We might have to get Brian in here.
It was the ones that don't want anybody to know and the ones that want everybody to know.
This is I don't know about in the Midwest specifically, but my patient population, I have like a little pre-op quiz I give people. And one of the questions is the Dr. C snatch scale. Like how snatched do you want to be? 1 to 10. And the point is what makes a happy patient is when the doctor and the patient are on the same spot, because we do have patients here that like don't want their spouse or their parents to know. And then we got patients over here that like literally want to look like the Instagram filter. So, most people fall somewhere between that ticker there. But when the patient and when I can hammer down where they want to be, I can deliver both. I mean, I can make it subtle or I can make it a little bit
super snatched.
Yeah. So okay. That's what he was. But that's not the Midwest. I mean, to be honest, again, like most of my patients are flying in. So we get the people, there is a type. I mean, definitely the Miami, LA crowd leans towards the Instagram filter. The Midwest crowd is a little bit more towards I'm not quite sure. I want people to know I had plastic surgery, but it's a good point.
So tell me, I'm sure this is something that you see so often when they're showing you like what they want to look like and they're showing you like filtered pictures.
I'll show you some. These are my inspo photos of like this week. This guy, I do a lot of men actually. So there's that guy. I mean, I don't know who most of these people are. That guy. These aren't the patients.
Those were the inspo pictures?
Those are the inspo. This is somebody who modified their own face on whatchamacallit. And I didn't have these props. I didn't know you were going to ask me this question. These are just the people like from this week. They bring in these printed out photos of like models or people that look really sexy. That, I mean, again, most people bring me the same ones. Look at this guy.
That's a nice jaw, though. I mean, I like that.
The guy that's coming in has got like no chin, and he's like, I don't want a chin implant. I'm like, look at his chin, man. You got to have a chin implant. This is a guy. He literally brought like Zac Efron, before and after.
Oh my gosh. So you do have to deal with this a lot.
Oh, yeah. I don't mind it, honestly. I mean, I kind of like a target, because it lets me know how much change they want. And I can explain to them like, dude, if you want to look like this, we got a lot of work to do.
I love that.
Yeah. And it's the reality,
I love that because let me tell you that some surgeons don't like wish pics.
Exactly, I know.
I like them because it helps me gauge my patient's realistic expectations.
Yeah,
like
exactly. Like, I don't want anybody to take this like offensively, but I have this short Mexican guy. He's overweight. He's got no chin, and his inspo photo is Tom Brady. And I'm like, okay, man, I get it. But, we got to be realistic also. So I do like, I try to tell people, like, bring me somebody that, like, kind of looks like you a little bit, at least. It has, like, and for better or worse, plastic surgery follows genetics and anatomy. So when somebody has similar genetics, it's just easy. So if that guy brought me Ronaldo, it's a little closer. Like, I can, a little more bone structure similar, so, but, we have fun with it. And I'll post the photos during the surgery.
I love that. That's so funny.
So, yeah.
But so they bring in these pictures and you're like, this is what I want to look like. You're like, I can do that.
I'm like, we can get you closer typically. I mean, depending. Some of them, they bring me realistic. Like the guy I did today brought me in a really nice, realistic photo. She's like, she looked like her, kind of had a nicer jawline, was a little slimmer, So I said, yeah, we can get pretty dang close to that, I mean, I give them listen, you got to give them because if I tell them I'm going to make them Tom Brady, and then they don't look anything like Tom Brady, then they're pissed. And I don't want them to be pissed,
Of course. You got to give them realistic expectations.
I got enough people to operate on now that, like, if I ain't going to make you happy, I'll tell you to go somewhere else.
Yeah. And okay, so with the inspo pic, I see that it'll probably help you figure out, okay, you need more than buccal fat removal because you guys, whenever you go in there, of course, you're trusting your doctor's judgment. Whatever they are recommending for you is what's going to get you to that look that you're looking for. So something you mentioned right now was it's not just chin lipo. You need an actual chin implant.
Yeah, I do a lot of chin implants. I mean, because it's a lot of times it's the structure. People with really nice jawlines, Ariana Grande, Angelina Jolie, like I said, Kerry Washington, Brad Pitt, these people, it's their bone structure is really what's getting them. They could be heavy, they could be thin, they're going to have good jawlines. And then there's people who are super thin and they still don't have a good jawline. Those people have the opposite anatomy. So, it just matters on those bases. And we can change some of that structural stuff if we need to,
So let me ask you a couple questions about chin implants because I don't have that much experience with them. And I would love for you to teach our listeners, like, what are they made of? How long do they stay? Do they ever have to be replaced?
It's a great question. So listen, from the chin and the jawline perspective, I got a skull here. I don't know if they can see. Is this video or so?
I'm recording this video. Hold on.
So yeah, like here's a skull. If you want to make the chin or jawline longer or sharper to make more definition, you can do a genioplasty. We cut the bone, we advance it forward, plates and screws. You can do a mandibular advancement. Again, plates and screws, big surgery. Don't typically do those aesthetically. You do it in like deformed people, trauma. The implants, I have 4 different types. Like one is silicone. One is Medpor, one is polyethylene mesh, and one is Gore-Tex. I like silicone the best for many reasons, but I'm open to discussion with patients on which one they want. Silicone implants are yours forever. You never have to change them out. Goes deep down on the bone. The woman I did 2 chin implants today. She said, I'm worried, what if I get hit? I said, listen, I did a hockey player. I did 2 MMA fighters. I told them they can fight after a month. It's not going to move the way we put it in. So you don't have to change them out. At the same point, you can change them out if you want. So mostly it's guys, they want a bigger one. They're like, hey, man, I like it, but I want a bigger one. So that seems to be a common. I have had a few women that, men, exactly. The guys are worse than the women. Man. And I do like 38% dudes. So I do a lot of men.
Well, you're the jawline pro.
The jawline is very masculinating. But the Gen Z millennial population, they're down for this kind of stuff. I mean, they'll do lip filler on these guys. Just straight men. I mean, I do gay men also, but like we didn't used to do straight young men. They just were like, oh, no, I don't do that. But the younger guys are open to it, So it's interesting.
The Gen Zs are a lot more open to, let me try it. Let's see what happens.
Everything. Yeah, that's a good point. Yeah. Not in a political sense, but they're pretty liberal in a lot of ways.
Which is good though, because this I think it's the new age of information where it's like just share everything. Yeah. Just share everything, and somebody might be going through exactly what you're going through, and then you're not alone.
Good point. Yeah, I mean the access to information is a good thing.
So okay, what is a typical recovery for a chin implant?
It kind of goes right along with the buccal fat. I tell people that for 7 days they look pretty stupid. After 7 days, they should be able to go to the grocery store, and people aren't going to be like, "You look weird." Or what happened to that guy? But your friends and family will think you look kind of odd for 2-3 weeks.
2-3 weeks. swelling, kind of
you just
still
kind of look
settling.
puffy. They might not be able to tell you what you did, but they might say, kind of like, your wisdom teeth that I tell people. Another thing I say is like, what you can do is if you wear glasses, get like a different pair of glasses, and then people are like, you look different. And you're like, I got new glasses. Or like cut your hair, or if you don't wear glasses, get some clear glasses and wear those. And that's like a nice way to divert attention, so.
If you have to go back to work and sit around people that might notice,
picky or something.
If they might notice, just have something on your face that you can. Oh, I changed my hair.
Yeah, shave your head or grow a beard. I mean, for the men, the women, you don't want to shave your head, probably, but dye your hair. Go from like brunette to blonde. Yeah, exactly.
Something different. Okay, Dr. Chicago. So why don't you tell us if our listeners want to come see you for a jawline rejuvenation, a jawline little pick me up? Where can they find you?
I mean, honestly, the quickest and easiest is if you DM us on Instagram, Many Faces of Chicago. Also TikTok, Many Faces of Chicago. YouTube, Many Faces of Chicago. Those. drbuccalfat.com, manyfacesofchicago.com. It's not hard to find me. If you Google Buccal Fat, you'll probably see me. I've been, all over it for, about 11 years now. So, yeah, we're happy to hear from everybody. Even if you don't want surgery, we're happy to hear from you. We like the feedback.
Okay.
Those are our avenues.
You really zoned in on buccal fat and kind of jawline in the last few years? I'm facial plastic, so I've always been face. The buccal fat, my first partner that I worked with was, he did a lot of BBLs. So we called ourselves the fat guys, and I would do the facial fat stuff and he would do the BBL stuff. So nice.
And we were both skinny. Yeah, we were both skinny. So it's kind of funny. He doesn't practice anymore, but so I from the beginning, I've kind of focused on it, to be honest. Fat transfer to the face, I do a lot of to kind of create the peaks a little bit, and then buccal to make the valley, chin implants to straighten the jawline. So it's kind of always been my little subspecialty. But I was doing a lot more blephs and a lot more otoplasties earlier in my career. But now it's just I'm so busy with this that, I funnel a lot of them the other ways.
I have a question for you. I'm really curious. So, okay, you know how there's plastic surgeons who, you niche down, and then there's they were facial plastic surgeons. Is it because y'all go through like a different training? Like, is there a different training that you go through to do facial?
So to be board certified in facial plastic surgery, you do 5 years of head and neck surgery. So that like as a resident when you're training, and that's like, people who have cancer on their tongue, you cut their tongues out, we reconstruct the mandible, you do the trauma to the face. That's like the treating the face and head as a whole. And then facial plastics, you do a 1 year subspecialize in only facial aesthetics. And then you're board certified in head and neck and facial plastics.
Oh, so that's
and then the general body guys, the guys who do body plastic surgery, they do like abdominal surgery, colon surgery for 5 years, and then they do plastic surgery, and then they do a body plastic surgery fellowship, like breast and butt, and they do face, most of them. I mean, the younger guys now pretty much only do body. Facial plastic surgery world is a little bit of a younger world. Like, I think it started like 30, 40 years ago. So the subspecialty, so like there's still definitely some general plastic surgeons who do a decent amount of face, But I mean, we can only do so much, So if you're doing boobs and butts, you're only going to be doing a third face, And there's some that do a really great job by 100%. By the way, there's even some facial plastics guys doing boobs and butts, which in my opinion, I wouldn't go to those guys for my boobs and butt. But
if it depends, whatever procedure they're doing the most of, that's the procedure I would go to them for.
That's really probably I would concur with that. Yeah.
Yeah. So
100%.
If I'm looking for a body procedure, I'm going to focus on body. You guys, I know we get like this 10 item wish list that we're like, oh yeah, I want to have 10 surgeries. Well, but we got to tone it down and focus on what's the most important and what bothers us the most.
And then I would advise the surgeons listening, kind of stay in your lane, So like pick your 3-5 procedures you do really well and just do a lot of those, suck it up and refer out the stuff you're not comfortable with.
And you know what? Let me tell you that I find it very refreshing to have surgeons refer to each other. Yeah. The show has a young population of surgeons. And something that I hear from my other surgeons, and I've heard from you today, is that you're not afraid to be like, I'm not specialized in this. Go see somebody who does this.
Yeah, exactly. Like I would consider myself still a younger surgeon, I'm right in the middle, I guess.
Well, you know what I mean. The younger surgeons.
down to, like Brian Rosette. Look him up. He's also great. Like him and I refer to each other a lot. So
I love that. And I think it's great. I mean, younger surgeons, because there's like the younger surgeons who are okay with going on social media and showing their faces and putting themselves out there. Because I know, like, even in the plastic surgery world, there's doctors who are like, oh my God, ew, never. I could never. And it's kind of like that. Okay, well, that's why you're not getting patients, because they're looking for y'all on Instagram.
Yeah, exactly. You got to play the game these days.
You got to go to where they're looking for you. So I think that's really great. I don't want to take up too much more of your time. We have like 3 more minutes. So,
okay,
I heard you speak Spanish.
Sí, hablo español. Estaba en España la semana pasada.
Oh.
Para fin de año y Navidad, mi esposa de una niña española.
Oh, wow. That's amazing.
Tú también.
Yo hablo mucho español. Mexicana.
Sí, pero de México o de los Estados Unidos.
Yo nací aquí, pero mis papás son de México, de Guadalajara y de Chihuahua.
Ah, bueno. Sí, es muy gracioso porque mis niños habla mejor español que inglés todavía. Tengo 3 hijos, uno con 4, 6 y 7. Y la cuidadora de mi casa, de México. Entonces, pero español de México es diferente de español de España, ¿no? Entonces, cuando estamos en España, mis niños, ellos, sus amigos de España diciendo, tú has hablado un poco raro, ¿no? Tu acento. So es muy gracioso.
That is so funny.
Yeah. And then I have like my own accent, When I met my wife, I didn't speak any Spanish. Like I took French in high school.
You took on the Spaniard accent.
Yeah, definitely. Yeah, because we go to Spain like 3 times a year. Like everybody I talk to, here I have like a 3-way, a Detroit accent, then a Mexican, because Chicago has a ton of, Mexican, Hispanic, Spanish speakers. At the Cook County Hospital, I still work, half a day a week. Like the majority of patients there are speaking Spanish, so, or maybe not the majority, but a good amount. And then, Spain, exactly. I have a little bit of a list. Yeah.
It's beautiful though. I love it. Yeah. I love it because you just opened up another door for you with patients who speak Spanish only. So you guys, si estás buscando un doctor en español.
Muchos pacientes no pueden hablar inglés muy bien. Y yo puedo hablar, mi español es como una niña con 6 años más o menos. Es que digo, porque mi niña tiene 6 años y aprendieron con ella.
Con ella.
Mira, sí, más o menos, en mi casa.
Muy bien, me gusta, muy bien. Gracias. Estoy muy orgullosa.
Gracias.
Thank you so much, Dr. Chicago, for coming on the show. You were so amazing and great, and you gave us such good information.
Hey, likewise. I learned a lot as well. So, and I'm going to get Allie G on here. I'm going to tell her right now.
Yeah, tell her. We love the coordinators. It's a coordinator-led podcast. So
I am in full support.
Awesome. Thank you so much.
Mavi, thank you very much. Have a good night. We'll see you.
We'll see you guys. All right, you guys. I'll see y'all next week.
Ciao.
If you enjoyed this episode, please go on Apple, write me a review. It's the best way for other women who are just like you, who need help, who are looking for information, valuable information on the internet. This is how they're going to find it. So go on Apple, give me a 5-star review if you love this podcast. If you want to support the podcast, the best way to support the podcast is through the website. If you need help through your journey, if you need help finding a surgeon, if you want to join the membership, if you're looking for Bruise Juice, you guys don't sleep on Bruise Juice. Y'all know I have my Bruise Juice 30 coupon code for y'all to use if you're having a BBL, if you're having liposuction, if you're having a tummy tuck, if you need to be using Bruise Juice all over your body. Stop using those other brands that are not tailored for your post-op recovery. Bruise Juice is formulated for your recovery. It's amazing. It nourishes your skin. It helps your fat transfer live. Don't sleep on Bruise Juice. Bruise Juice 30 is the code.
And don't forget, new episodes every Monday. I'll see you then.